All right, I guess we're doing this today.
I guess so.
All right, so on today's episode of Ethics and
What?
a new legislation has been passed allowing anyone to decide when they want to die. So,
Yeah, so this is called Medical Assistance in Dying, aka MAID.
anyways, let's dive into what MAID is.
So, to just introduce the topic, medical assistance in dying is a process for people who are eligible. So, this is anyone who's 18 and older to receive assistance from a medical practitioner in helping someone pass away. So, this was made legal in Canada around June 2016, and the Criminal Code of Conduct only allows this to occur under very strict circumstances. So, since this is a new topic, there is a lot of controversy resulting in the ethical implications that this may have on individuals receiving MAID, as well as their family and hospice workers. So, recently there have been new legislative changes that have been receiving a lot of media attention. So, for instance, the process of MAID to be eligible for people suffering from mental illnesses has been pushed back from March 9th, 2023 to now March 17th, 2024.
So, talk about how different groups feel about this because Statistics Canada did this survey, and 6 in 10 Canadians are against the idea of MAID being an option for patients or people who suffer from mental illness. So, talk about that. So, talk about how different groups feel about this because Statistics Canada actually did this survey, and basically, 6 in 10 Canadians are against the idea of MAID for people who have mental illness. So,
And in the same survey, 3,500 Canadians were interviewed. And under this survey, there was healthcare practitioners as well as Canadians with BIPOC and LGBTQ members, as well as people living with chronic mental and physical conditions. And this survey found that a large majority of the people are in support of medical assistance in dying and support it as a constitutionally protected right.
okay, so now for a break for an ad brought to you by a medical psychiatrist.
Are you sad all the time? Do you feel like nobody in this world is there for you? Are you constantly thinking about death? Well, if any of those apply to you, my name is Mary Cross, and I'm a psychiatrist. My phone number, place of work, and email address is all on the screen for if you ever want to book a consultation with me. Remember, we're here for you. We hear you, and we definitely see you.
So, if you're struggling, Mary is here and she's really great with what she does, so definitely consider her. So, moving on, what are your thoughts on MAID? How do you feel about this?
So personally, I am a big supporter in MAID, and more specifically for people with terminal illnesses that can't be fixed. So my sister, who's currently in her last year of medical school, was able to witness a lot of MAID procedures be done. One specific case she told me about was when an 84-year-old man diagnosed with a terminal brain tumor applied for MAID because he lost full mobility from his waist down. He was also in constant pain and had to take several different types of medication to help his symptoms, yet nothing seemed to help. It was determined by a team of doctors that nothing could be done to rectify the situation. So with this in mind, he would also spend the rest of his life in constant pain with no cure for his illness. He was in a stable state and signed off on making his decision, so it was valid and they continued with the procedure. And according to my sister's medical expertise, they use a drug called midazolam along with propofol. So propofol is a drug used to help patients relax and sleep throughout the procedure. So this wouldn't be harmful or painful for the patient at all. So again, my sister had to verify the formality of his condition and make sure that nothing could be done to increase the quality of his life.
Okay, but as a medical practitioner, how does your sister feel doing the complete opposite of what doctors are meant to do? There's a Hippocratic oath that every single doctor, medical practitioner, anyone basically in the medical field has to take. So does that oath not apply for MAID? Do doctors and physicians not have to like abide by it. It literally goes, I will prevent disease whenever I can. Prevention is preferable to cure. I will remember that I remain a member of society with special obligations to my fellow human beings, those sound of mind and body as well as the infirm. So you're just okay with people dying and murdering them instead of saving them?
First of all, stop trying to save everyone. You're not Wonder Woman.
Okay.
And to answer your question, so the priority of a doctor is the treatment and rehabilitation of their patients. So when it comes to terminally ill patients, there is no medically approved treatment left to aid these individuals in increasing their lifespan. So they'll spend a life of pain and suffering with nothing to ease it. At this point is when patients can't take this anymore and choose to end their life. Even if a doctor disagrees, they should be able to follow their patient's wishes while exacerbating unnecessary precautions about MAID.
Okay, but like how serious would a terminal condition have to be? Don't get me wrong, I know they're pretty serious, but like I just don't like, for like cancer, for an example, like there's chemotherapy and radiation. For Parkinson's disease, there are medications. Heart disease, there are surgeries. For lung disease, same thing. Like for every disease, like what I'm trying to say is there is a practitioner, someone in the medical field who's done the school, like done the work, done the years and years of training, even debt, like years and years of debt to be a professional in this industry. What I'm trying to say is these are people that have literally taken an oath so that people, to basically help people combat these illnesses without being put down like a dog. Medical assisted dying just seems to completely overshadow the already deficient ethics and morals in the world. And again, these are just my opinions, but intentionally casting death on yourself completely contradicts like life in general. Like it completely violates every principle from both religious views and within the medical system. Not only that, but there are literal hospices for people that are terminally ill so that they can die and wither away in peace. Like they're people who have literally done the school to become hospice workers to make it easier for these people. So it just seems odd to me that this system even exists to basically put people down and kill them.
Yeah. So a big point that you stated was like pretty much the validity about terminal illnesses and like how they affect one's quality of life. So I actually do have a story about this. So according to Dying in Canada, there was a patient named Margaret who was diagnosed with leukemia and only had months to live. However, she miraculously survived for another 3 years. After this time, however, her symptoms worsened significantly and it became unbearable. She gradually lost her strength, had to give up Pilates, and became too tired to walk. And even more so, she had to give up her career as a nurse. And in her last few days, she only moved from the bed and sofa. So something that she said that really resonates with a lot of people who have gotten MAID is, I feel like I'm already on the outside looking in. I'm an observer rather than a participant, a useless burden, sitting on a couch someone else could use. So this quote really analyzes the amount of physical and mental pain Margaret undergoes because of her condition. Her quality of life declines tremendously, and there was nothing more to be done to save her. So instead of fearing death, she was a lot more open to it as her pain would finally come to a stop.
Although I do feel for Margaret and her story, like it's definitely something that no one should have to go through. But you're basically saying she was told she had 3 months to live, conquered that and got 3 extra years, but then got sick again, and then she decided to give up. Even though there's a high chance of her like making it maybe 4 years instead of 3, like it just doesn't make sense. Like why not just go with it and keep fighting, you know? Like I don't know, it just seems a little odd to me personally. Like I just, yeah.
So a big thing you have to understand is that when getting her diagnosis of leukemia and having only a couple months to live, her systems. So a big thing you do have to understand is when getting her diagnosis of leukemia and only having a couple months to live, her symptoms weren't as severe as she had recently, and she was still able to care for herself. However, after the 3 years, she was bedridden, wasn't able to do things she enjoyed, like again, her career being a nurse. And at this point, her pain had come like really continuous for months. And knowing this, she knew things weren't going to get better. So she decided to choose a path of applying for MAID. So with her family by her bedside, she was alone together.
I mean, now that you put it like that, like I guess it's kind of valid, but to each their own.
So throughout our podcast, I have noticed a lot that you seem to be quite against MAID. So is there any like specific reason, maybe personal issue that you resonated with?
Yes, there is actually. So basically, my grandfather was diagnosed with lung cancer just over 4 months ago, and it just really hit me hard because like according to Statistics Canada, there's only a 61% chance of survival, which is high in hindsight. But in that moment it just becomes so real. Like all of a sudden, cancer isn't just something you're hearing about from others. Like it's not a story you're viewing on like social media like TikTok, Instagram, or even YouTube. Like this is personal to you because someone who you love and cherish is going through something that people often look down upon. Like it just puts everything in perspective, like all of a sudden it's just so real. My grandpa was sick for a really long time. He was bedridden on chemo and radiation. I mean, he went through with the surgery to get the cancer out. And he was fighting hard to be healthy again, and he's 70 years old. The fact that he even had that fight in him just spoke so like volumes to me. So whatever it is that is killing anyone's time, like Margaret, and it's just so personal to me, like when people take what I think is the easy way out. Before, when I heard death, I when I read about it, like I hear death. But now, like, it's just changed because I have a reason to believe that you can overcome literally anything. Literally anything.
So firstly, I just want to say thank you for being vulnerable and sharing your personal story. And I am really glad that your grandfather was able to fight through his cancer. So something I was just curious about when hearing your story is if your grandfather's symptoms had gotten more severe, that his quality of life continuously decreased, would you then want him to apply for MAID?
I mean, with like any cancer, treatment and whatnot, like, and especially with chemo, there's always going to be like the symptoms of like all that medication that you're taking, for a very long time. He was throwing up all the time. There was actually a point where we all thought like he isn't gonna make it. Like genuinely, we really believed that, and it was really hard to see someone like the strongest man that I knew, who had like the highest pain tolerance ever. Like you could pinch this man with both hands and he would be able to just not even blink. It just like if it had gotten worse, which I'm like again like there is like a chance, I personally would like again like this is literally like like you asking me if my grandpa would want to kill himself. Like no, like he is very adamant on going naturally, going the way that he wants, and it is his decision at the end of the day. But I would never like ask him that, because it's just such a personal question. Like whenever his time is up, I know very well that he would never ever want to be euthanized, basically. And the biggest thing is like my grandpa actually said, and I quote, like, life is a journey. You got to let nature take its course when it decides to take its course. Like, it's not up to you. And I mean, it's paraphrased a tiny bit, but it's definitely like stuck with me. So yeah, that's how I feel about that.
So I do totally understand where you come from and believe if you are able to fight for your illness, you should. And a big thing you said that I do resonate with is when you talk about how everyone has the right to choose if they want to go through with MAID. And you were speaking about how your grandfather personally wouldn't, because he would rather let nature take its course. So I do think that this is definitely everyone's independent perspective and opinion on whether they should go through with MAID or not. And at the end of the day, it's their personal choice.
I agree with that in the sense that it's like, I just think it's valid, but I think about family, you know? I think, you know, obviously you have to be an adult to conform to this procedure to be done, but like these people come from families, people who care about them, you know? And, you know, it's just sad.
Yeah, I do definitely agree with you. MAID, people like receiving MAID definitely does impact a family a lot. Just being able to like see the suffering they go through. However, at the end of the day, I feel like me personally, if I had to witness a family member of mine suffered through an illness for so long and see them like the life physically drain out of them where they're not able to enjoy their life anymore and do things they enjoy, I feel like at that point I would want them to just go through with MAID if that's something that they want, to not see them suffer. Even though it would have a long-lasting impact on me, I feel as though, like, not to be selfish, I feel like if that's what they need to do, then they should.
Yeah, I guess so, in a sense.
So to wrap up our discussion, I do have a statistic here. So did you know?
Another one. Okay.
Did you know that 84% of people with a chronic physical mental condition or disability support the right to medical assistance in dying?
Anyways, so where do you draw the line when it comes to MAID? Like, what are your final thoughts?
So my ultimate position on the topic is I am definitely in support for MAID for people with physical conditions. So examples just like terminal patients, and believe that it is within their right to choose whether or not they want to end their life. However, me personally, I would draw the line at people with mental conditions, as I believe MAID to be a process for someone who takes MAID as a last resort. So in my opinion, there are a lot of new up and coming strategies on how to deal with mental illness, and MAID shouldn't be considered or even eligible to people who have many different options available.
Okay. All right.
So I am just curious to understand, throughout this podcast, you have spoken a lot about how you're against MAID for specific limitations. So I was just wondering, where do you personally draw the line at MAID?
I draw the line when it comes to a thick line when it comes to people with mental illness. I am against that. I think we've come to an understanding on this episode today, but to explain, I feel like society just has that moral duty to protect and preserve all life, to basically allow people to help, like doctors to basically help people destroy their lives. It just violates a fundamental duty, and we just have to respect human life and mental illness. There's drugs, there's medications, there's different things, like the mental illness realm in general, the world of it, it's definitely gone to a better place in the world. There's more attention being brought up, there's help that you can get. So I agree with you, medical assisted death for mental illness patients, totally against it.
So overall, the topic we've spoken about, MAID, is definitely a controversial one at that, as it has a lot of ethical and legal issues being discussed within it. So overall, you have heard our stances on it. We do come into agreement on how people with mental illness shouldn't be eligible for MAID.
Yeah.
However, we do have our differences in the topic as well. Me being wanting people with physical conditions to be applying for MAID, whereas Anisha does not.
Yeah. Sorry. Thank you for listening to this episode of our podcast with Anisha and
Sudarini.
Join us for our next episode, where hopefully we'll come into an agreement on the abortion and why it shouldn't be controversial. But anyways, stay tuned for the next episode of Ethics and What?